morning, everyone. My name's Carla Macias, host of San Antonio's own medical show, Best Docs Network, featuring Forest Park Medical Center. Each week, our show is bringing you some of the latest discussions on today's health topics and procedures offered in the area. Now let's get today's show started by introducing San Antonio radiation oncologist, Dr. Jui-lien Chou.
A shock when I was diagnosed with breast cancer at age 49. I don't have a family history of breast cancer. I always thought that I was on a low risk group to have a breast cancer. I own a breast center with a very up-to-date technology, and I was doing cancer screening for myself every single December. 9 months later, after a good mammogram and ultrasound, I felt a lump in my left breast. My breast tissue was very dense, and the dense breast tissue would make it really hard for an X-ray mammogram to pick up a breast cancer at early stage. I was fortunate that the tumor was not spreading, but I was unfortunate because there weren't very good tools at that point to give me the assurance before the surgery that the tumor was actually localized. And because of that, I made the decision to have mastectomy, which was not necessary. But that was not the hardest part. The hardest part was still the fear that this cancer would come back. And it turned out that with the Oncology test that I carried a high risk recurrence. At that point, I decided to go ahead and have called the adjuvant chemotherapy. The adjuvant chemotherapy is to have the chemotherapy after surgery to increase the chance for survival. Currently, I'm 9-year breast cancer survivor. Am I cured? Very hard to tell. But you cannot live in the fear. You gotta live every day like, you are winning the war, right? You are the one. You are the key person to hold that stance. Good diet, regular exercise, good family support, they all contribute to the overall health and cure of your cancer.
Forest Park Medical Center in San Antonio is located at the southeast corner of I-10 and 1604. And it is at a stunning location. It's at the beginning of the hill country. It sits upon a hill. The views from the rooms and the patios are breathtaking. The facility is like a 5-star hotel, but with a hospital inside. And hospitals can be intimidating and scary places, and when you walk in, there's this unique smell, and the artwork takes your attention. The facility and the water features are very calming. The patient rooms are outstanding. They're appointed nicely. They're also comfortable for the patient's family. If the family would like to stay with the patients, it's comfortable for the families as well. We have 16 VIP rooms, which are basically family rooms. It's a room inside a room where the patient's family can stay with them. The other piece that's really interesting is we've tried to take into account all of your senses when you come in, and everyone jokes about hospital food. Well, not at Forest Park Medical Center. We have a chef, and our facility and cafeteria and food service is outstanding. It is second to none, and we pride ourselves on that, on being different and unique. We really do work to make sure that it is a calming environment and helps improve the healing of the patients. It's reassuring for the families as well when they come there, that they know that they're not just part of a large quantity of patients, a large number. It's unique and specific for that patient, and the care and attention is given to the patients and to their families. The Forest Park model is unique in that it is majority physician-owned, and the physicians do make the decisions locally about the care, about the facility, about the equipment that's offered. I'm extremely excited to be a part of this project. It's something to be part of a project from the ground up, and I've actually been here from the beginning with this project, and to see a difference that it's making in San Antonio and to see the excitement with the physicians. They're very excited about the new facility, about having a place where they can call the shots. The nursing staff that we've hired to date is outstanding. San Antonio will be the first hospital that has its own cardiac cath lab. This hasn't been done in any other hospital that Forest Park has ventured into in any other market, but it made sense for this community. And so we're very excited about that. This type of facility is tailored to the needs of each individual community. It's not cookie cutter. It's what makes sense for the city of San Antonio and the physicians involved in this project.
Sunflower seeds can help protect your heart. Consuming a quarter cup of these seeds delivers half of your daily value of vitamin E. Vitamin E helps keep your heart healthy and fight infections.
Here at Forest Park Medical Center, not only did we look locally, but we looked nationwide for the top managers, directors, and employees. And not only did we focus on their experience, but we focused on customer service, because customer service is our #1 thing that we look for, because we want to treat our patients exceptionally.
What impressed me the most about the facility is that they picked the top of the staff that they could find, and most of the staff have years and years of experience. So when people come here, they're getting the best care possible.
We were very fortunate. We had a large candidate pool, a lot of applicants that were very interested in working at Forest Park. So we were able to hire the best and the brightest. And it was an exciting opportunity to work through all the interviews and really look to focus on not only finding that clinical excellence in knowledge and experience coming from our staff, but also those that were really focused on customer service, those that really wanted to provide patients with that outstanding care, those that really wanted to treat patients as if they were their own family members.
We are a surgical specialty hospital, and our length of stay is less than 2 days. So we are able to allow our patients to be discharged at less than 2 days due to our excellent nursing ratios that we have, which is 4:1, and that's an outstanding patient ratio that we have, so we can really focus on the patient and their needs.
Getting what we need for the patients is the most important thing, and seeing to the needs of the patients as quick as we can is the most important thing that all of the staff has in common here. We want the recovery to be excellent. We want them to be well, we want them to feel needed, we want them to feel like they get the care that they're paying for.
I really enjoy the atmosphere at Forest Park. It's very positive, and I'm glad that I'm with the Forest Park family. It's a great place to work and a great place to be.
Up next, Dr. Richard Salter pays a visit to Highland Park High School's Science Festival to talk about Forest Park Medical Center's use of robot and state-of-the-art technology to prepare and perform surgeries. Dr. Salter also discusses the importance of teaching kids the wonders and advancements in medicine and how important it is to seek a career in the medical community.
Today we're having the Highland Park Science Festival, and they've asked me to come speak specifically about robotic surgery. And I've had the Intuitive people and Forest Park partner together to get 2 demonstration robots so the kids can actually see what we do with a robot and kind of how we get prepared for surgery.
We have 15 students who have opted to come see Dr. Salter and actually get to manipulate this Da Vinci robot. I personally know a lot of these kids, and I've taught them a couple of times. Most of them are seniors, and a lot of them are interested in medicine. So this is, I think, going to be a really inspiring event for them.
The kids have absolutely loved it. They have just been full of questions. They can't wait to get up there and actually get on the machines and feel what it's like to operate the machines. So I think we've got some great minds here, and I think that if they can just be channeled into the right direction, then medicine has a very bright future, and these kids will be part of it.
We are so fortunate that members of the community feel like they need to give back to these kids, and I don't know if they really realize the impact that they have on a lot of students, because this is bringing the actual profession into the classroom. You know, it's a great event, and it's gotten bigger every year.
So much of medicine has been maligned lately, and I'm afraid we're losing our really smart kids going into other professions because of the length of training, the risk of lawsuits, all the negative things that they hear about, and they don't hear any of the positive. So I wanted to make sure the kids know there is a positive to medicine, and that if they like technology and they like to be involved in the newest stuff, this is where it's at with surgery. And we have a great medical center in Forest Park, and they like to get out and help the kids see what's available for our community. And I've always wanted to be able to get out and show the kids what they have available. And Forest Park has always been open-minded about trying new technology, new equipment. They also want to get out and show, you know, people what's available, what they can offer that's different than some of the other hospitals.
Donna has a question for Dr. Jackson Ombaba. What causes arthritis?
Arthritis is the destruction of the cartilage in the joint. All the joint, they have got a cartilage. The cartilage acts like a cushion between the two bones. When this cartilage is destroyed, there's no cushion between the two bones in the joint, and then the bones start rubbing against each other. When the bones start rubbing each other, they try to heal. On the process of healing, they form bone spurs. The more bone spurs they form, the more painful it becomes.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
Vector vision is like a GPS system for the brain. A MRI can be done and digitized to an instrument in the OR. So in real time, you know with your instrument where you are on the patient's skull, within the brain, or within the white matter itself. The vector vision at Forest Park Frisco has the latest software and the latest technology, which makes it much more accurate. The benefit to the patient in minimally invasive brain is obviously a quicker recovery time, smaller incision, better cosmesis, faster healing.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read their background and training, find their office locations and directions, as well as request an appointment. One of those best doctors here in San Antonio is cardiologist Dr. Juan Martinez.
Marlene and I have been best friends probably for 30 years now. We do pretty much most of the things together. Grocery shopping, gambling. We go down to Eagle Pass whenever we can.
Before we experienced the heart attacks, I wasn't as energetic as I used to be. Yeah, he's kind of special.
I had two surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial, respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day and felt very comfortable during the process.
Just walking in, it did seem like a five-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room. He knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me.
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health.
Weight loss could be a challenge, and remember that weight gain didn't happen overnight, so it's going to be a gradual process. It is important to keep in mind that when we consume diets that are high in carbohydrates, carbohydrates eventually will turn into sugar, and then the sugar will cause insulin release. The higher the level of insulin, the more weight you gain and the more hungry you feel. So what you want to do is try to keep insulin levels to a minimum. What you have to do in this case is follow a diet that's high in protein and very low in carbohydrates. By doing this, not only does it help you lose weight faster, but at the same time it'll bring down your triglycerides and your blood sugar. The other concept that's very important is to have a high fiber content in your diet. The higher the fiber, the slower the carbohydrates get absorbed. Try to consume portions that are about the size of your fist. So remember, 2 vegetables, 1 protein, and 1 carbohydrate. Also try to incorporate snacks that are high in protein. For example, nuts, low-fat cheese, and Greek yogurt. Make sure you limit trans fats and saturated fats and alcohol drinks, especially things that have a lot of sugar. For example, mixed drinks. Make sure you drink 6 to 8 glasses of water per day. It'll make you feel full and at the same time stay hydrated. So exercise regularly for at least 30 minutes a day and make sure you keep your total number of calories to a minimum. For example, 1,500 or less usually will help you lose weight. Some people may need more, some people may need less, so make sure you check with your doctor.
The PRMA group specializes in breast reconstruction surgery post-breast cancer. They also specialize in plastic surgery here in the San Antonio area. Now let's meet one of those surgeons from the PRMA group, Dr. Minas Chrysopoulo.
I'm a board-certified plastic surgeon specializing in breast reconstruction and cosmetic surgery. Breast reconstruction is my #1 passion. My training was very much geared towards that, as well as cosmetic techniques, and really combining the two is what all of us at PRMA thrive to do for each patient that walks through our door. It's very important to customize the approach based on each individual's desires, wants, the situation in their life, their social situation. It's important to have many options and present them and let the patient really be part of the decision-making process.
If you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. You can do this by clicking on San Antonio under the Our Doctors tab. Now let's continue today's show with San Antonio urologist Dr. Christopher Cantrill. Dr. Cantrill will be discussing reconstruction after bladder cancer.
I had been experiencing an unremitting series of bladder infections for almost a year, and I was feeling really uncomfortable and was not responding to the medications that were being offered to me by an OB/GYN, and I was feeling really frustrated. And finally, it was suggested that I go see a urologist.
When she first came to see me, she was having a lot of problems with what she thought was recurrent urinary tract infection. They were finding blood in her urine. She was having to go to the bathroom quite frequently and having pain with urination. And given that she'd had so many problems, we end up starting to look for more other reasons as to why people are having these infections. And in the clinic, I was able to look inside of her bladder, and I saw a small tumor growing inside of her bladder, or at least a mass that appeared to be like a bladder cancer.
He told me what was going to happen, and we tried a procedure and thought it had worked, and actually I had to go back a second time.
Unfortunately for Carol, we looked back in 3 months later and her tumor had recurred, which confirmed my concerns that this tumor was coming from the tube draining her kidney.
He checked again at several months later and wasn't totally happy and decided he wanted to do some reconstruction work. And I was glad. If we were going to do it, I wanted it to be right.
Whenever we're doing surgery for cancers like Carol's of the ureter, the goal for us is to try and save as much of her kidney as we possibly can. Well, her tumor was isolated just in the lower portion of her ureter, and I felt fairly confident if we would be able to just take that portion of the drainage tube out, I could save her the rest of her kidney and take her ureter and reimplant that into the bladder to allow her to keep her kidney.
When he did the reconstruction of the bladder, he was able to preserve the bladder, enough of a percentage of it that I am fine. And I am very grateful for that, very grateful.
You notice something about Forest Park Medical Center the moment you walk through the front door. Gone are the smells, the sights, and the sounds that are typically associated with most hospitals. And in their place is something decidedly different. You see, Forest Park Medical Center was designed to be comfortable, inviting, even calming. Fact is, many of our patients don't want to leave. Come experience for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
And that'll wrap up another episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. For more information on any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com.